Welcome to Save As Ability, a podcast to educate and inform you about disability employment issues. My name is David D'Arcangelo, and I'm your disability policy expert.
Disability pensions. That's our topic on today's episode of Save As Ability. Welcome back. It's David D'Arcangelo, another episode. If you can continue to help us grow the channel, like, subscribe, share, comment, we'd appreciate it so we can keep great content flowing for you. Today, we're talking about disability pensions. And as I was doing research here to what people want to hear about, this was coming up. So let's do it. Let's have an overview that covers both public and private disability programs. This is a 50,000 foot view. We could have 5 different episodes about this. There's a lot of layers here, but really this is try to give people an understanding of or shed some light on how disability pensions function within and beyond just the public ones that we think about. But all right, first let's define what a quote unquote air quotes disability pension is. It's broadly defined like, first let's consider that there's the public variety. Those are going to be public benefit programs that exist from the federal government and state government and things like that. But then there's also the private variety. And we're going to talk about both and some distinctions here. So generally, public programs are funded through government programs, such as the Social Security Administration. So SSI, SSDI are generally considered in that realm, particularly SSDI in the U.S., okay? And other countries and other jurisdictions may have other things, but in America, that's the large driver. So these benefits often require either a work history with SSDI or qualify for people need to qualify for some type of social assistance, okay? Now let's look at the private. In the private, we're talking about these are often funded through employer-based or employer-sponsored disability insurance programs or personal policies that people take out with large insurance companies, and they're purchased from gigantic insurance companies, fill in the blank insurer that provides long-term disability coverage. And you can pay into that and you can purchase it. You've seen the ads on TV or, sometimes you can get it through other plans if you're, commingling with like big funds and things like that. So these plans can supplement or substitute for the public benefit programs as well. So if you're getting the public benefit programs, you may or may not necessarily also be able to take advantage of these. It's going to be a lot of factors there, your age and different conditions that you're going to be able to provide paperwork and substantiate the disability or not, okay? So the core purpose for both, though, is kind of the same, and that's to offer financial subsistence and support for people who are unable to maintain full-time work due to the disability. So, and cover things like, all of the essential living costs, rent, food, healthcare expenses, all those types of things, okay? That's what we're talking about in the realm of disability pensions here. So, these both exist together, the public and private programs, and these benefits, are great examples of how policies and programs have been put in place to provide for people with disabilities, okay? And it reflects society's commitment and our government's commitment to provide for our people long-term. And we're going to get into that next. There's both short-term disability pension, long-term disability pension. Let's talk a little bit about that and eligibility and things. So on the public side, eligibility, like if you're talking about SSI, SSDI, you've got to have a certain work history with SSDI, for example. You've had to pay in a certain amount of quarters. You have to meet the medical definition, and you have to provide, doctor's certification of it and things like that. So SSDI, for example, there's about 9 million Americans receiving those benefits each year. That's considered long-term disability pension benefits, right? The financial impact is the average monthly benefit amount is around $1,500. I think $1,483 was the last amount I looked up. That was a 2022 number. So it's probably been adjusted. They adjusted each year, the commission does. And then there's also SSI, which is, a little bit different. I think people are using it as a pension program. And again, if you qualified, it varies based on federal and state supplements, but it also it usually includes Medicaid eligibility in many states, as well as, there's different factors there. So there's other pieces to that as well. Oh, hey, Isabella, for making a cameo appearance.
I was just watering the plant.
All right, great. Thanks for doing that. So back to this disability pension. So we also have state-specific short-term disability insurances as well. Certain states like California, New Jersey, New York, Rhode Island, Hawaii, they have laws in place that provide for short-term disability coverage and things to cover wages up to several months. Some, I think, maybe even up to like a year. So that ensures that workers have at least temporary income if they encounter a disabling event. So public disability pensions have a principle that individuals have contributed into the system, they've paid into it, and when they need those dollars, they get it back, right? So SSDI is primarily that pay-in program. SSI, your tax dollars are paying for that. So I think that's a good thing, right? On the private side, though, disability pensions, that's what your employer is paying in. That's what you're paying in personally. So let's look at private disability pensions that are employer-sponsored plans, okay? There's usually two types of those. Short-term disability, which typically covers a portion of your wages for just that, a short term, like 3 to 6 months or something. Then there's a long-term disability. That extends benefits beyond 6 months, sometimes through like retirement age. So it's going to depend upon your employer. It's going to depend upon how much you're paying in, a lot of different factors there. But we do know from data from the Bureau of Labor Statistics that there's about 40% of private sector workers who have access to employer-sponsored short-term disability benefits. And then there's about 35% that have access to long-term disability coverage as well. Further, on the private side, there's individual disability insurance that you can purchase and pay into. And that some of that is purchased privately and used for self-employed individuals. Some of it is customized policies that you might have within a larger insurance plan, where you have like term life insurance, or you have like an annuity, or some other types of insurance vehicle that you're using to be able to draw down on if you have a disabling event and you want to be able to access those dollars. So they vary in duration, percentage, the wage replacement. Those are all very different depending upon the plan you have and how much you're paying in, a lot of different factors. So the good thing about the private plans is that they can oftentimes be combined with the other plans we talked about and be mixed and matched and fill gaps and things like that. And sometimes they have different options of, how you can take the money out and the frequency and all different things like that. So shifting gears, let's just touch briefly on the application and eligibility factors. That there's some common denominators here, particularly among the public plans. You usually need like some type of medical verification when you're getting these cash benefits. So you've got to demonstrate that, like for Social Security, for example, you've got to demonstrate that you have an inability to engage in, air quotes, substantial gainful activities, okay? And so that's when you're essentially taking yourself out of the labor force. You're saying, no, I can't work anymore because of this disability, right? And then there's like administrative reviews that can get done there, and they evaluate your medical records, and they can even ask for exams, and there's other like vocational factors. That's on the public side. On the private side, there's all these different definitions that each policy has that's unique to each one. So, what does disability mean for one may vary. So it's going to depend upon your particular plan. And some are more restrictive, requiring an inability to perform any work, while others focus on like the own occupation. That's like a term that's in the law that private plans observe as well. So, the documentation is different. You might need physician statements. You might need to go see specialists. You might need independent evaluations. So there's different things to the public programs, the private programs that they're going to ask for. But both really are essentially doing the same thing. They're providing the dollars there that you need long-term, either short-term disability or long-term disability to provide for all the things we talked about. So we could go on all day about this. This is a huge subject, and there's really a lot here. But, let's just wrap it up briefly and say that it's a good thing that this is all in place because it provides options for people with disabilities. Now, on the public side particularly, there's a big debate about how best do we do that? How best do we provide for our Americans with disabilities long-term, disability-wise? And we can talk about that and debate that. But just to let you know that there is long-term public, short-term public, long-term private, short-term private, and there's a lot of variations in between. So go check out some of our earlier episodes to find out about all the different programs. And, we've talked about some of the reforms that might be coming to modernize these programs, both in the public and private sector, by the way. So, we'll talk about that further as they come. But I think the takeaway is that there is resources out there. There's options out there. And if you're somebody who needs guidance and eligibility, there's plenty of resources out there. We'll put some of them in the description here, both on the public and private side, that you should go look at and check out. And, you should have an understanding that there are both public and private disability pensions and how they can work together and how they can help people, be financially stable to be able to provide for themselves. That's what we want here. Independence, self-determination, access to opportunity. That's what we're all about here at Save As Ability. Hope you got something out of this episode. If you want to hear other things from future episodes, please drop us a comment, like, subscribe, share, so we can keep great content flowing for you. I appreciate you, and I hope you have a great day.
For more information about disability employment issues, please visit our website, disabilityemploymentsolutions.com. The Save As Ability podcast is available on Apple Podcast, Spotify, our YouTube channel at Disability Policy Expert, or wherever you stream your podcasts. Subscribe, stream, rate, and review our shows. Your ratings and reviews help our show reach new audiences. Produced by Pod Pro Entertainment. Save As Ability lives within a network of podcasts located at podproentertainment.com. #TheNewRadio. Again, my name is David Darkangelo, and I'm your disability policy expert. Until next time, thank you. I hope you have a great day.